Meanwhile, concern about the flu, both swine and seasonal, has some New Jersey hospitals looking to change their visiting policies to no children allowed. The change has been prompted by the New Jersey Hospital Association. NJN News health and medical correspondent Sarah Lee Kessler has that story.
The New Jersey Hospital Association has issued hospital visitation guidelines designed to limit the spread of H1N1 influenza.
They recommend that hospitals limit visitors under the age of 18 and that they obviously restrict any visitors who are showing signs of illness, fever, coughing, that sort of thing.
The guidelines, which are voluntary, were released earlier this week, but some hospitals, including Jersey City Medical Center and St. Clair's, had already imposed age 18 visiting restrictions. Now St. Joseph's in Paterson has raised its visiting age from 16 to 18. There's a big sign in the lobby. This visitor's reaction?
Really doesn't make any sense. You know, if you have a relative or something that's in the hospital, you want to come visit them, regardless of your age, you should be able to do that.
But Dr. James Pruden, St. Joe's Emergency Department Chief, disagrees.
Children spread germs very effectively, and this one is spreading among children. And again, we don't want to expose them to whatever exists in the hospital.
We see that there's been a higher rate of exposure to children, a higher rate of infection, and a higher rate of complication. So by keeping them out of the hospital, we'll ensure that they won't in turn get infected.
But at Hackensack University Medical Center, 18 and up has been enacted only in areas where pregnant women, babies, and children are hospitalized. New Jersey Hospital Association guidelines also emphasize hand hygiene, covering coughs and sneezes, and avoiding visiting hospitalized patients when you're sick. Visitation guidelines are also designed to protect healthcare workers, many of whom haven't received H1N1 inoculations yet because the vaccine is in such short supply that their hospitals haven't gotten shipments yet. Hackensack is one such hospital. I understand you ordered 8,000 doses as a hospital, and not a single doctor or nurse has been able to get vaccinated here.
Well, I think some people have gotten vaccinated, but not through the hospital.
Vaccine is expected soon. In the meantime, there are hand sanitizing stations all over the hospital and brochures about reducing the risk of swine flu. Sarah Lee Kessler, NJN News, Hackensack.